Post-traumatic stress disorder. PTSD is a complex mental disorder that emerges in response to traumatic life events, and is characterized by chronic disturbance in emotions and relationships. Diagnostic criteria for post-traumatic stress disorder include exposure to traumatic event, re-experiencing the traumatic event through dreams, hallucinations, or flashback episodes, avoidance of stimuli associated with the trauma, through avoidance of people, places, activities, and conversations that may trigger recollections of the event. Experiencing negative alterations in cognition and mood, such as inability to remember an important aspect of the event, persistent blaming oneself or others for causing the traumatic event or for the resulting consequences, persistent negative trauma-related emotions like fear, horror, anger, guilt, or shame, as well as distorted cognition about the cause and consequences of the event. Experiencing marked alterations in arousal and reactivity, like encountering angry outbursts, hypervigilance, which refers to being over-aware of potential threats, self-destructive behavior, as well as concentration problems and sleep disturbance. Psychotherapy of post-traumatic stress disorder involves cognitive processing therapy, in which the therapist and the patient examine what the patient is thinking and telling himself about the trauma, and they decide together whether those thoughts are accurate or not. Also involves prolonged exposure, which includes repeated exposure to thoughts, feelings, and situations the patient has been avoiding. Prolonged exposure procedure helps the patient learn that reminders of the trauma don't have to be avoided. Pharmacotherapy of post-traumatic stress disorder includes selective serotonin reuptake inhibitors, such as fluoxetine, atypical antipsychotics, such as aripiprazole, which may reduce agitation and improve PTSD symptoms, as well as alpha blockers, such as prazosin, which may have a role in treating trauma-related nightmares, leading to significant improvement in sleep.